According to marchofdimes.org/parasite, per 1,000 of infant mortality in the United States, Black infants account for 10.8% compared to 4.6% of white infants. This shows that Black infants are 2.4 times likely to die before their first birthday. I am a nursing major with a strong passion for women and children's well-being. And today I will be sharing with you and enlightening you about the infant mortality rate among African Americans in the United States. I know you'll be wondering, what is infant mortality? According to the Center for Disease and Control and Prevention, infant mortality rate is the probability that a child born in a specific year or period will die before reaching the age of 1. Of all the developed countries in the world, the United States have the highest rate of infant mortality of 5.4% per 1,000, and Black infants are 2.4 times likely to die than white infants, and they are 4 times likely to die due to low birth weight. Today, I'll be sharing with you factors that increases the rate of infant mortality among African Americans. And the first one is the health care system. Most people of color are usually uninsured or they rely on Medicaids. And 90% of Blacks lives in the southern states of the United States. And these are states that do not have non-expansion of Medicaids. And it has shown that they lack healthcare coverage and good providers, and they lack hospitals and facilities because of the community they live, and this will affect the rates of a newborn living in such communities. And even if there is hospitals or facilities in this area, they have low quality of maternal and neonatal care. When a child with low birth is born, they don't have the well-equipped neonatal care to take care of this child for a child to live. And the second one is the systemic racism and discrimination. Black are racially profiled. They lack no or little prenatal care. Blacks are often denied the treatments that are due to them, and they have shown that people of other colors that take care of Black women and their baby, they are not happy doing so, and they lack dignity and respect when they are cared for by other races. According to the Office of Minority Health of the United States Department of Health and Human Services, Florida has seen a significant improvement in the mortality of Black newborns that were cared for by Black physicians, because those Black physicians are able to relate with them and able to give them care that is appropriate and good. And the next one is employment. Low income has been often associated with low birth weight, and most mothers want to take care of their children when they are born, but some job does not pay them for maternity leave, and some job does not pay them for maternity leave, and some mothers are afraid of losing their job when they take maternity leave. Studies have shown that mothers who take maternity leave has shown 50% decline in hospitalization and infant deaths. In summary, I have talked to you about the factors that affect infant mortality rates among African Americans, which is the healthcare sector, the systemic racism and discrimination, and employment. This shows that government has a lot to do so that Black newborns are able to live Everybody has the right to live. Black newborns and their children also have the right to live. Thank you.